2 a.m., the apartment is dead quiet. Gerald, 62 years old, solid, independent, not a man who complains, wakes up unable to breathe. His chest feels like someone parked on it. He sits up, grabs 2 pillows, shoves them behind his back and waits. After a minute or two, the air comes back. He sits there in the dark, heart pounding, staring at the ceiling. This has been happening for months, getting worse. At first it was once a week, now it is almost every night. He has been to the emergency room twice. Both times they ran an ECG, listened to his lungs, checked his oxygen, and told him things look okay for his age. Both times they sent him home with nothing but a follow-up recommendation he never got around to scheduling. Nobody in that ER ever asked him one simple question: what medications and supplements are you taking every single day? When Gerald finally walked into my practice and I asked that question, the answer explained everything. Every symptom. The breathlessness, the swollen ankles, the weight he could not explain, the suffocating feeling that hit him the moment he lay flat. What Gerald was taking, and what millions of people over 50 take every single day without a second thought, was quietly weakening his heart muscle, stiffening his lungs, and flooding his body with fluid while he slept. Not a rare drug, not a chemotherapy agent, something you can buy at any pharmacy without showing an ID. And I am willing to bet that at least one of the things Gerald was taking is sitting in your medicine cabinet right now. There is a belief that has been drilled into people so deeply that almost nobody questions it. If I can buy it without a prescription, it cannot really hurt me. That is a myth, and it is one of the most dangerous myths in modern medicine. The medications I am talking about are NSAIDs, non-steroidal anti-inflammatory drugs, ibuprofen, naproxen, the pills you reach for when your knee aches, your back locks up, or your shoulder will not stop throbbing. They work, nobody is arguing that. For short-term pain, taken occasionally, they are effective tools. But here is what nobody tells you clearly enough. These drugs were never designed for daily, long-term use. They were tested in clinical trials lasting weeks, not years. Yet millions of people over 50 take them every single morning like a vitamin. Monday, ibuprofen. Tuesday, ibuprofen. 3 years later, still ibuprofen. No one ever stopped them. No one ever reviewed whether it was still appropriate. The packaging says, ask your doctor. But the 12-minute appointment does not cover what happens to your heart after 800 milligrams a day for 36 months. That conversation does not fit between your blood pressure check and the next patient in the waiting room, so it simply never happens. And you walk out thinking everything is fine because nobody told you it was not. What I am going to walk you through in this video is exactly what these medications do to your heart, your lungs, and your kidneys when you take them consistently over months and years. Not the rare side effects buried on page 9 of the insert, the predictable, well-documented damage that accumulates quietly until your body starts sending distress signals you cannot ignore. Signals exactly like the ones that woke Gerald up at 2 a.m. To understand what went wrong with Gerald, you need to understand what these pills actually do once they enter your system. Every NSAID works by blocking an enzyme called cyclooxygenase, or COX for short. This enzyme produces chemicals called prostaglandins. Prostaglandins are the molecules responsible for inflammation, pain, and fever. Think of them as alarm signals. When you twist your knee, prostaglandins flood the area and scream at your brain. Something is damaged here. Pay attention. NSAIDs turn down the volume on those alarms. The swelling goes down. The pain quiets. You feel better. For a short-term problem, a headache, a pulled muscle, a sore joint after a long day, that trade-off makes perfect sense. You block the alarm, you get relief, your body heals, you move on. But here is the part that changes everything. Prostaglandins are not just pain signals. They do critical protective work throughout your body that has absolutely nothing to do with pain. They maintain the mucus lining that protects your stomach from its own acid. They regulate how much blood flows through your kidneys. And they help your kidneys manage the balance of sodium and water in your bloodstream. When you block prostaglandins for a few days, those protective systems dip slightly and recover. No lasting harm. But when you block them every single day for months or years, you are not just managing pain. You are systematically shutting down the mechanisms your body depends on to protect your stomach, filter your blood, and keep fluid levels in check. And that is exactly where Gerald's trouble started. Not with one pill on a bad day. With 1,000 pills, taken one at a time, over 3 years. Let me walk you through what was happening inside Gerald's body, because this is the part his ER doctors never explained. The first hit lands on the kidneys. Prostaglandins help regulate blood flow to the kidneys and keep them filtering efficiently. When NSAIDs suppress those prostaglandins day after day, the kidneys lose their ability to excrete sodium properly. Salt stays in the body, and wherever sodium goes, water follows. Fluid starts accumulating in the bloodstream. Blood volume creeps up, not overnight, but steadily, week after week. Now the heart has a problem. It is pumping against a larger volume of blood than it was designed to handle. At first it compensates, it works a little harder. You do not feel anything, but over months, that extra workload begins to take a toll. Cardiologists have a name for this: volume overload. It is one of the earliest stages of heart failure, and it can be completely invisible until it is not. The second hit is blood pressure. NSAIDs raise blood pressure by an average of 3 to 5 millimeters of mercury. That sounds like nothing, but sustained over years, on a cardiovascular system that is already managing age-related stiffening and plaque, that small persistent increase compounds into real arterial damage. The third hit is one almost nobody knows about. Ibuprofen specifically can interfere with the protective effects of low-dose aspirin, the very medication many seniors take to guard their heart. The aspirin is trying to keep blood from clotting dangerously. The ibuprofen is blocking that protection. Two pills in the same medicine cabinet, working against each other. Clinical data shows that regular NSAID use increases the risk of heart failure hospitalization by roughly 20%. Gerald's early-stage heart failure was not genetic, it was pharmaceutical. His heart was drowning in fluid, his kidneys could no longer clear, because the very pills he took for knee pain had disabled the system meant to protect him. Now follow the fluid, because it does not just sit in your bloodstream politely waiting to be dealt with. When the heart begins to struggle with that extra volume, it cannot pump everything forward efficiently. Blood starts to back up, it pools in the veins, it builds pressure in the vessels leading to the lungs, and eventually fluid begins to seep out of those vessels into the lung tissue itself. This is pulmonary congestion, fluid leaking into the tiny air sacs where oxygen is supposed to cross into your blood. These sacs, called alveoli, are built to be dry. They are designed for gas, not liquid. When fluid fills them, oxygen exchange collapses. Imagine trying to breathe through a wet sponge. That is what Gerald's lungs were doing every single night. And here is why nighttime is the worst. During the day, gravity pulls excess fluid down into your legs. Your ankles swell, your shoes feel tight, but your lungs stay relatively clear. The moment you lie flat, that equation reverses. Gravity redistributes all of that fluid from the legs toward the chest. Pressure on the pulmonary system spikes. The air sacs flood. That is why Gerald needed 2 pillows. That is why he woke up gasping at 2 a.m. Doctors have precise terms for this: orthopnea, difficulty breathing when lying flat, paroxysmal nocturnal dyspnea, sudden breathlessness that jolts you awake at night. These are not mysterious symptoms. They are not aging. They are not anxiety. They are textbook clinical signs of fluid overload. And in Gerald's case, that fluid overload was being driven entirely by a pill he bought at the pharmacy without a prescription. For knee pain, he could have managed differently. If anything I have just described sounds familiar, the nighttime breathlessness, the extra pillows, the swollen ankles, the daily ibuprofen habit, then you have just learned something critical about your own health. The question is what you do with it. Most people watch a video like this, feel a knot in their stomach, and go right back to their routine. Nothing changes. The pills stay in the cabinet. The symptoms stay unexplained. You do not have to be most people. As a doctor, here is what I would tell you to do next. Get screened. Have someone look at your heart function, your lung capacity, your kidney numbers, not next year. Now, while this information is fresh, and while the warning signs are still early enough to act on, Care Health is a free platform that connects you with healthcare options in your area. Cardiac screenings, pulmonary function testing, clinical trials for heart and lung conditions, new treatment options you may not even know exist near you. You fill in a short form, your date of birth, gender, a few basic details. It takes about 30 seconds, costs nothing, and there is no commitment. Care Health simply matches you with what is available in your area, so you can take the next step. Click the link in the description below, or point your phone camera at the QR code on screen right now to scan it. Now, let us get back to what you need to know. Because NSAIDs are not the only thing in your medicine cabinet doing this. Here is where it gets worse. Because most people over 50 are not taking just one thing. They are taking 4, 5, sometimes 8 different medications and supplements every single day. And nobody, not their cardiologist, not their primary care doctor, not their pharmacist, is looking at the full combination. In medicine, this is sometimes called pharmaceutical stacking. Each individual medication causes a mild, manageable side effect. But when you stack 3 or 4 of those mild effects on top of each other, the combined load on your body is no longer mild. It is a compounding force that nobody warned you about because nobody was tracking it. Let me give you the common accomplices. First, calcium channel blockers like amlodipine, one of the most widely prescribed blood pressure medications in the world. Amlodipine works well for pressure, but it relaxes blood vessels in a way that allows fluid to leak into the surrounding tissue. The result is peripheral edema, swollen ankles, puffy feet, tight shoes by evening. Sound familiar? Second, gabapentin and pregabalin, prescribed for nerve pain, sciatica, fibromyalgia, extremely common after 50. Both can cause fluid retention and unexplained weight gain that patients and doctors routinely chalk up to aging or diet. Third, high-dose calcium supplements. Millions of women take them for bone health, but emerging research links excessive supplemental calcium to arterial calcification, meaning the calcium does not all go to your bones. Some of it ends up stiffening the walls of your blood vessels. Now come back to Gerald. He was taking daily ibuprofen for his knee, amlodipine for his blood pressure, and a calcium supplement his wife told him was good for his bones. 3 separate sources of fluid retention and cardiovascular strain, 3 different reasons they entered his life, and not one doctor was looking at all 3 together. Your body does not fail silently. It warns you. The problem is that most people either do not recognize the signals or blame them on something else entirely. So let me walk you through exactly what to watch for and what each signal actually means. The first signal is swollen ankles and tight shoes by evening. You wore these shoes comfortably this morning. By 6 p.m. they are cutting into your skin. That is not your feet spreading with age. That is fluid accumulating in your lower extremities because your body is retaining more water than it should. The second signal is unexplained weight gain, not gradual gain over months from eating more, a sudden jump of 2 to 4 pounds over a few days when nothing about your diet changed. That is water weight. Fluid your kidneys should be clearing but cannot because something is interfering with their filtration. The third signal is needing extra pillows to breathe at night. If you have slowly gone from 1 pillow to 2, or you find yourself sleeping in a recliner because lying flat feels suffocating, that is early pulmonary congestion. Fluid is creeping into your lungs when gravity shifts it toward your chest. The fourth signal is waking up at night gasping for air, Gerald's signature symptom. Fluid that redistributed while you slept has overwhelmed your air sacs. The fifth signal is a dry, persistent cough that worsens when you lie down, not a cold, not allergies. Fluid irritating the lung tissue from inside. The sixth signal is unusual fatigue during activities that used to be easy. Climbing a flight of stairs leaves you winded. A short walk exhausts you. That is your heart straining against a blood volume it was never meant to carry. None of these mean you have heart failure. Every single one of them means your body is sending a signal that something you are putting into it is causing a problem. And if you catch it now, the fix might be as simple as changing what you take. Once the right questions were finally asked, the answers came fast. His cardiologist ran an echocardiogram and identified early-stage diastolic heart failure. That means Gerald's heart muscle had stiffened. It could still squeeze blood out, but it could no longer relax properly to fill back up. The pump was working, but it was working rigid and tight like a fist that cannot fully open. His kidney function tests showed a reduced filtration rate. His kidneys were not failing, but they were struggling. They had been operating under suppressed prostaglandin levels for so long that their ability to clear sodium and fluid had quietly degraded. The echocardiogram also showed mildly elevated pulmonary artery pressure, that is the early fingerprint of fluid backing up into the lungs. The wet sponge was already forming. Now here is the part that surprises most people. Gerald's doctors did not add more medications. They subtracted. They took him off daily ibuprofen entirely. For his knee pain, they replaced it with a structured physical therapy program, a topical anti-inflammatory gel applied directly to the joint, and targeted exercises to strengthen the muscles around the knee. They reviewed his amlodipine dosage and adjusted it. They pulled the calcium supplement and replaced it with dietary sources and vitamin D. That was it. No new prescriptions, no procedures, no surgery. Within 6 weeks, Gerald lost 8 pounds. Not fat, water. Fluid his body had been hoarding for years because the medications in his cabinet were telling his kidneys to hold on to every drop. His ankle swelling disappeared. He went back to sleeping flat on one pillow. He stopped waking up at 2 a.m. gasping for air. The solution was never a new pill. The solution was removing the wrong ones. Let me be clear about something before we go further. I am not telling you to throw away all your medications tomorrow morning. That would be irresponsible and potentially dangerous. What I am telling you is that the daily ibuprofen habit deserves a real conversation with your doctor, not a silent refill. So what do you do instead when your knee aches every morning and your back locks up every evening? Start with topical anti-inflammatory gels. These contain the same active compounds as the pills, but they are applied directly to the joint. The medication reaches the tissue that needs it without flooding your entire bloodstream. Systemic absorption is minimal. Your kidneys barely notice it. Second, structured movement. This sounds counterintuitive because when a joint hurts, your instinct is to stop using it. But research is very clear. Low-impact exercise like walking, swimming, or cycling strengthens the muscles that support and stabilize the joint. Stronger muscles mean less load on the cartilage. Less load means less pain over time. You do not rest your way out of chronic joint pain, you move your way out of it. Third, physical therapy, not generic stretching from a printout. A targeted program designed for your specific joint, your specific weakness, your specific movement pattern. This is one of the most underused tools in medicine for people over 50. Fourth, nutrition. Omega-3 fatty acids from fish or quality supplements reduce systemic inflammation. Cutting processed sugar and refined carbohydrates lowers the baseline inflammatory load your joints operate under every single day. None of this replaces your doctor. All of it gives you something better to bring to your next appointment than silence. Ask your doctor this exact question. Given how long I have been taking this, is it still helping more than it is hurting? Everything I have described in this video becomes significantly more dangerous after 50. And after 65, the risk increases dramatically. Not because older people are fragile, but because three specific biological systems converge in a way that turns a manageable medication into a ticking clock. The first factor is kidney filtration. Your kidneys naturally lose filtering capacity with age. After 50, the rate at which your kidneys clear drugs from your bloodstream declines measurably every decade. That means a medication that was processed and eliminated efficiently at 40 now lingers longer, accumulates more, and exerts a stronger effect than it was ever meant to. The ibuprofen you took at 45 and forgot about by dinner is still circulating at 65 when you go to bed. The second factor is cardiac reserve. A younger heart has a buffer. It can absorb extra fluid volume, compensate for higher pressure, and recover from temporary strain. After 50, that buffer shrinks. The heart tolerates less. The margin between coping and failing gets thinner every year. Fluid overload that a 40-year-old heart would shrug off becomes the event that tips a 65-year-old heart into failure. The third factor is polypharmacy. The older you get, the more medications you accumulate: blood pressure pills, cholesterol drugs, nerve pain medications, supplements, each one prescribed or purchased independently, each one carrying its own mild side effects. And nobody, at any point, sitting down and asking what happens when all of these run through the same kidneys, the same bloodstream, the same heart, at the same time. Here is the core message. Daily over-the-counter pain medications, especially NSAIDs, were never tested or approved for the kind of long-term use that millions of seniors have adopted. They cause fluid retention, they elevate blood pressure, they impair kidney function, they weaken the heart, they fill the lungs with fluid. The warning signs are visible if you know what to look for. And in many cases, the fix is not adding something new. It is removing something that should have been stopped years ago. How old are you? And how long have you been taking something for pain every single day? Write it in the comments, I want to know, because it will shape what I cover next. So here is what I want you to do after this video. First, go to your medicine cabinet and look at what is in there. Not just the prescriptions, the over-the-counter bottles, the supplements, the pills you started taking so long ago you forgot why. Write them down on a piece of paper, everything you take daily, and bring that list to your next doctor's appointment. Second, check yourself against the warning signs we covered. Swollen ankles by evening, unexplained weight gain over a few days, extra pillows at night, breathlessness that wakes you up, a cough that gets worse when you lie down, fatigue that does not match your activity. If even one of those is present, do not wait for your annual checkup. Move that conversation forward. Third, ask your doctor the question. Given how long I have been taking this, is it still helping more than it is hurting? That single sentence can change the entire direction of your care. And remember, that free health screening link is still in the description. 30 seconds to check what is available near you for cardiac screening, lung health, or clinical trials. It costs nothing. Take care of yourself. Gerald's story did not end in a hospital bed. It ended with a doctor who finally asked the right question and a patient who was willing to hear the answer. The damage was real, but it was caught early enough to reverse. Not everyone gets that window. This channel exists because nobody in a 12-minute appointment is going to walk you through this. There is no billing code for it. There is no revenue in prevention, but prevention is worth more than every treatment that comes after it. And now you know what to look for.